Scusate, c'è un ricevitore ancora che manca. Se potete controllare cortesemente nelle vostre tasche, nelle vostre borse, se avete dimenticato di consegnarlo, se vi ricordate il numero è il numero 12. Se lo trovate anche più tardi, magari lo potete consegnare agli organizzatori che poi ce lo fanno avere. May I have your attention, please? There is still one headset missing, so please check your... Okay, we found it. Thank you. Great.
Good afternoon. I hope you had a good lunch. Now, the difficult will be to be aware, not to sleep during the afternoon, but I'm sure we can succeed in this. First of all, I would like to thank you to everybody for being here. This afternoon we will deal about the role of the companies in green healthcare. So we will have some introduction to the theme and then the presentation done by the single enterprise that are here, both from the Swedish side and the Italian side. First of all, I would like to give the floor to Bocconi School of Management. Bocconi is the private university from Milan, very active in the management area. So I give them the floor to present the Italian healthcare sector and the opportunities for the companies. Please.
Thank you very much. Maybe we can upload our slides. So first of all, I want to thank you for the invitation and for this great opportunity for speaking to you all today. And my name is Patrizio Armeni. I'm here with my colleague Francesco Costa. We are both associate professors of practice at SDA Bocconi, which is the School of Management of Bocconi University. It is now ranked among the top 5 universities worldwide for both research, custom projects, and master like the MBA. Our special interest in terms of both research and teaching is centered around the healthcare sector. And so we spend our research time in understanding how the healthcare sector is working. We work together with companies that work on the Italian market, both pharmaceutical, medical device companies, and service providers. And we are also active as consultants for themes like market access, understanding the different stakeholders that matter when dealing with the Italian sector. And nowadays we want to speak a little bit about the peculiarities of entering the Italian healthcare sector. And so I will alternate my slides with my colleague just for you in order not to get asleep after 5 minutes. I know that after lunch that may be a little challenging. So I'll start with the agenda. So we will start with a slide about the peculiarities. So just a few flashes just to understand the general flavor of the Italian healthcare system, made mainly by policymakers and public stakeholders, but also private stakeholders. Then we will have a look at some figures about the Italian market for pharmaceuticals and medical technologies in general. And then we will close with a brief overview of the opportunity that is nowadays active thanks to the European funds that have been delivered to European countries following the COVID pandemics, that a part of them will be dedicated specifically for the renewal of many instances of the healthcare sector. So just start with the first point, which are the general characteristics of the Italian healthcare sector. So the Italian healthcare is mainly public. So we have 75% of public coverage of whole healthcare expenditures. The organization is structured as a national health service, which is very important and very different compared to systems that have, for example, a public insurance. Why? Because the national healthcare service is not only a payer, but it's also a direct provider of services. So the public institutions are active not only in planning and financing healthcare, but also in providing directly the service. So it's very important for them to acquire, internally develop, or to acquire from the external the competencies that are needed for providing these services, and we will have a look to how these kind of services are nowadays changing. There was a strong period of cost containment between 2012 and more or less 2015, followed by a new period of expansion due to the fact that during these 3 years, the priority for the Italian healthcare sector was to pay back the deficit that was accumulated the years before. Once the target was reached, a new expansive era was started. Obviously, cost containment is always an issue, but nowadays it's not just cutting expenditure, but is evaluating the value for money of new investments. So a new way of reasoning has been established, not only to cut budgets, but also, but instead to evaluate the convenience of new investments through the evaluation, for example, of the ratio between costs and benefits, for understanding what is the value generated by a new service. So this kind of evaluations are nowadays spreading all around Italy, both at the central but also at the regional level. There is a budget that is annually dedicated to drugs and to medical devices. For the cases where the budget is exceeded, companies and regions are together called to repay the excess, and there is a very strong role of regions. So the subnational architecture of the system based on regions. For example, here we are in one region, which is Emilia-Romagna, which is one of the most active both in the terms of research and development and in the service design. For example, Emilia-Romagna is one of the regions that have invested more in the continuity between hospital and community care, generating all the intermediate services that were afterwards copied by all the other regions, because here they worked very well. Since 2001, regions are the main, let me say, local architecture relevant for healthcare. So there is a national planning, but then regions are accountable for the organization, the provision of services, and for the financial sustainability. So they are entitled of the accountability on budget. So they are the ones that organize services on their let's say, local geographical territory of competence, but then they also are responsible about the total expenditure generated in their system. So there is a high degree of autonomy. There is a trend towards making decision-making more interdisciplinary, so around new technologies, not only physicians, but also different levels of policymakers like medical engineers, hospital pharmacists are nowadays called to participate together. And we have more and more regional assessments of new technological opportunities. Another very important point is that different regions in Italy, because of this autonomy, may differ in the kind of decision they make, and this creates some inequalities between different parts of Italy. Where there are regions that are really excellent in the healthcare provision, there are other ones that are a bit lagging behind. And so among the most, let's say, performing ones, there is Emilia-Romagna, for example, because it has invested for a long time in the continuity between hospital and community care mostly. And also procurement, public procurement is evolving, and nowadays the trend is to integrate more and more the quality and not just the price in the purchasing of goods and services, but also another trend is to integrate the service part into the concept that is acquired. So before, every single object was, let's say, differentiated, like, for example, I'm buying a drug, a medical device. Nowadays, the service provision and the servitization are making objects more complex, with drugs with a service component, with medical devices with a service component, and nowadays there is a trend toward a more integrated way of understanding also public procurement on these more complex objects. I leave the floor to my colleague for the next part dedicated to the facts and figures of the Italian pharma and medical device sector. Please, Francesco.
Thank you, Patrizio. Good morning, everyone. I'd like to introduce two most important sectors in the healthcare system, the pharmaceutical industry and the medtech industry. And let's start with description of some facts about pharmaceutical expenditure. And the total pharmaceutical expenditure, that means public and private pharmaceutical expenditures, grew in the last 20 years with an average yearly rate of 2.3%. In the last the last favorable year, the 2020, the total pharma expenditure was 29.3 billion of euro. An important point is that the public coverage is stable across the years. In fact, the private pharmaceutical expenditure grew only of 4% in 20 years. In fact, the incidence of private pharmaceutical expenditure on total pharmaceutical expenditure in the last year, in the 2020, was only the 30%. But pharma industry is not only expenditure. It's also an opportunity for a nation like Italy. In fact, the pharmaceutical industry is an important resource for the Italian economic and social development. And in line with the Sustainable Development Goal of the United Nations, Italian pharma sector is a leader for reinforcement of capabilities, activities of social responsibility and environmental impact reduction, and also for work-life balance improvement, for example, after the COVID emergency of the last years, and the last but not the least, for social activities. The pharma industry also gave a strong impact on the environment respect, with a decrease of 32% of gas emissions in the period between 2008 and 2018, and with a reduction of 59% of energy consumption in the same period. Italian pharma market and the industry is well balanced between domestic and multinational companies. In fact, the multinational companies cover the 57% of total pharma company present in Italy, with the particular distribution in which the 22% are companies from the United States and the 35% companies from European countries and Japan. Very important is that Italy is one of the most important pharmaceutical hubs worldwide, and in the 2020 we had a production value of 34.3 billion of euro, and the export increased by 75% between the 2015 and 2020. Consider that the European average increased only by 48% in the same period. As I said before from my colleague, Italy is strongly regionalized, and the pharmaceutical industry is strongly based in north of Italy, in the 5 regions of north of Italy. For example, Emilia-Romagna is responsible for around the 6% of the total export of the pharmaceutical, and is the second region for investment in research and development. Now, some facts and figures about the medtech company, medtech market that generates a total market, so that means public-private expenditure and export, around 17 billions of euro. with over 4,000 medtech companies located in Italy that employs more than 94,000 persons employed in the sector. And very interesting is that medtech industry is mainly located, like pharma industry, in the north of Italy. And in Emilia-Romagna, we have the biggest biomedical hub in Europe, the Mirandola hub. Among medtech sectors, the biomedical area is the most represented sector, but very important is the forecast, the outlook for the next year, with the home and digital care that is considered the rising sector for the near future. So it could be a very important occasion for investment. And another fact very important is that in the 2020, the last available year, the value was 8.1 billion. That means an increase of over the 5% versus the previous year. The export value in the 2020 was around 6 billion of euro, with an increase of around 8% with respect to the 2019. But who are the main countries that buy medical devices from Italy? They are United States, France, and Germany. Your slide.
Yes, we conclude with a few hints about the opportunities that are nowadays opened thanks to the National Recovery and Resilience Plan. As you know, the European Commission has granted a huge amount of money following the COVID pandemics for updating, I would say, most economic systems and making them more sustainable, more agile, more digital, and in general. So these funds are dedicated to the update and renewal of most economic systems in Europe, where, let's say, some initial trends were observed, but these funds will give a boost to these trends. The general package was based on 750 billion euros, and some of them are grants, some of them are loans, so let's say sustained loans. Italy has acquired a total around 260 billion euros for the whole plan. And how is this plan structured? So it has 6 missions that are clustered around 3 strategic areas that are digitalization and innovation, ecological transition, and social inclusion. Health is a bit in the between of all of them, but actually there is a mission specifically dedicated to health. The issues around health is the need of renewing some kind of services, not only through digitalization, but also through a more advanced integration between what happens in the hospitals and what happens in the community, and a new way of integrating also the relationship between service providers and good providers and the public system. So in order to overcome the classical distinction between the seller and the purchaser, but to go towards more advanced also partnership models that will be part of the future of this healthcare system. So there are almost 20 billion euros dedicated to health, and there are trends that are specifically identified in the healthcare transition. So as you can see from the first point, there will be a lot, more than 1,000 community homes and 381 community hospitals for proximity assistance. So as I was telling before, we are investing in creating a continuous between what happens in the community and what happens in the hospital. So in order to avoid a void between the community care and the hospital care that has been particularly relevant during the COVID pandemic, so we want to create a more continuous system. As I was saying before, Emilia-Romagna region was one of the pioneers in integrating the hospital and the community care. I remember that more than 15 years ago, I was doing a project where Emilia-Romagna was introducing the first system for integrating the hospitals and the community care. And nowadays, we have funds to foster again this trend. So this is a huge opportunity, in particular for regions like this one that have invested for a long time in this trend. There will be more home care, so not just separating for elderly people the possibility of staying home helpless and going to a structure that is specifically dedicated, but there will be a continuous of services also in this case. So home will be one of the places where healthcare will be delivered with a more technological advance, with connection systems with the healthcare system, not just giving services full stop. There will be some form of connection that will link home as a point of care and also the rest of the healthcare system. Then there will be more local operational centers for remote assistance, so this is part of the digitalization process. And then there is also part of these funds dedicated to new equipment, both for fostering digitalization, but also for renewing the technological park that is nowadays a bit outdated. Because of the cost containment, we were not able to update the big technologies, and nowadays we have funds for doing so. So in order to synthesize our messages, there will be new structural entities, and so there will be a need for new and different services compared to the ones that are nowadays available. So whatever news in this direction will be welcome. There will be more continuity of care, and this means that services and technologies will be at the center of the innovation process. So we are not just looking at the technology itself, but how this technology will be integrated in the healthcare service provision, starting from so from the very first part of the healthcare service delivery, from diagnosis, from prevention, and then throughout the whole clinical pathway of the patient. So wherever the patient is, at home, in an intermediate structure, or in the hospital. So technology per se will be not just the key, but the way this technology is integrated into the service delivery will be the key. And then there will be a higher diffusion of virtualized pieces of clinical prevention pathways. So digitalization will happen and will go on not just in replacing some forms of care, but in introducing structural pieces of the service delivery that will be virtualized. For example, structurally, some parts of the follow-up visits for patients will be virtualized. For doing so, we need a service infrastructure that nowadays is still missing. And so these are the main challenges, but also opportunities posed by this plan. And this is an historical opportunity because this is the moment where we can upscale the whole process. And there is also an opportunity for service providers for entering this market right at this moment in this phase. So thank you very much for your attention, and we leave the floor to the following presentations.
Thank you. Thank you. Thank you very much. Grazie. Thank you very much for your contribution. Now we move to a presentation of the digital twin of the greenest hospital in the world. This is something that we are waiting for. It's Felicia. It's very interesting to hear from you. Please come. In fact, in Bologna, we are starting, the regional government with the Bologna municipality is starting to design a digital twin of the city that will be extended to all the region for the smart city, climate change, weather forecast. So we are starting smart mobility. So it will be very interesting also to hear from you.
Okay, thank you for that introduction and for the very interesting presentations that we've gotten to take part of today. It's been very fruitful to hear both from the Swedish side and the Italian side. Okay, so as I was just introduced, my name is Felicia Hedetoft, and I work as the Communications and Member Coordinator for NCSH and our network. And you have previously gotten the introduction to NCSH from my colleague Daniel, so I will not dwell on that for this presentation. So these next 15 minutes will not at all be about me. In fact, I will even ask you to step out of this room for a while, which might be needed in this kind of sleepy afternoon that we're all experiencing right now. Because even though we are here in the lovely Bologna today, we will now transfer ourselves to the world's greenest hospital. And that is Grönkopinki, a digital hospital created to showcase and make accessible the greenest solutions available from the Nordics to the world. Right, so the hospital is located in the city of Grönkopinki. And as you might be able to see on the map, this is exactly in the middle of the Nordics. The climate here is just right. You will experience the relatively warm summers and the relatively cold winters. You are close to a stream, a fjord, mountain, forests, ocean, and agricultural land. Your neighbors come from all over the world with competence and experience grown organically over the years. And everyone in Grönkopinki, they benefit from collaboration and community efforts. So all these conditions mean mainly two things. First, it means that Grönkopinki has climate resilience. When faced by a disturbance, Grönkopinki, the city, and the hospital is able to bounce back. Because of its diversity and its competence and its population, it has a form of robustness in a changing environment. And then number two, these conditions also mean that Grönkopinki is able to deliver the best healthcare possible, even in the middle of the uncertainties that we are currently facing and that we will likely be facing also in the future with climate changes and future disease outbreaks. So Grönkopinki is then the world's greenest city, and it has the world's greenest hospital. But it is not just kind of a distant dream of the future. All of this, as I will hint to in this presentation, is actually possible to create already today. But why did it actually get so green? What is it about Grönkopinki that made it the greenest in the world? And this actually started many, many years ago. If we leave Grönkopinki as it stands today and go back to the 800s, we meet a Viking settlement. And the Vikings from Grönkopinki, they were innovators and forever changed the shipbuilding technology and enabled their populations to travel further than anyone had ever traveled before. So in short, this meant that the Vikings, they started stretching the borders of both countries and of technologies. And then we need to take a very big leap forward, all the way to 1863, to find the second factor that made Grönkopinki so green. Because Grönkopinki's population was at an early stage covered by publicly financed comprehensive healthcare. And you might guess as just how early that was, because the date is up on the screen. So that was in 1863. And this led to Grönkopinki being able to create preventative healthcare for long-term positive health effects. And then to this big mix, we add the 1960s. So this was, as some of you might have experienced, was a decade framed by environmental awareness and policies, And in 1967, as actually Daniel mentioned earlier, the Environmental Protection Agency was formed. And this then sparked innovations with sustainability as its focus area in the years to come. So you've now gotten kind of a very brief history lesson. But why is this important then to note, this history timeline? Well, it's important because if we briefly step out of Grönköping, we find that the Nordic countries have a very similar history to Grönköping. They have this history of caring for nature and for people, and also of sharing green innovations and knowledge across continents. And as my colleague, I keep referring to Daniel in this presentation, but he's mentioned that our work at the NCSH is based on this history of the Nordic countries and getting this knowledge out to the world and to learn from the world to further boost this history to continue into the future. Because today a new business area is emerging. Companies are currently developing a lot of products and services to boost the sustainable transition in the healthcare field. Everything from ventilation to closed water systems to sustainable furniture is being developed and installed on the market. So as NCSH, we then want to get these best practices and green solutions out to the world. And you can see just on this image, the back of some heads on our Nordic delegation to Canada in 2019, where this sort of sharing was the aim. But another way of facilitating the sharing of knowledge, as both the Swedish Energy Agency and my colleague has mentioned earlier today, is through our assignment with the Swedish Energy Agency to work with energy and climate smart healthcare. And the basis of this assignment is to spread Swedish knowledge and best practices beyond our borders, so abroad, by creating these kind of long-term relationships worldwide. And I know that you were promised to get an insight into this report series earlier today. So part of this assignment with the Swedish Energy Agency is the Nordic Know-How series. And this all started during the pandemic. As we all experienced, we couldn't meet each other in the same way, nor could we communicate in the same way as previously. So the Nordic Know-How series was a way of making knowledge accessible. And the series is based on, it's short reports with practical solutions as a form of go-to source to those planning future healthcare. And the topics range from renewable energy production to lighting, geothermal energy. And we are actually currently planning the launch of a seventh one, which will be on the topic of cooling this autumn. And we discussed a little bit before lunch about the importance of language and the language barriers that exist today. So actually, these reports are all written in English to kind of lower this, this barrier in terms of language. So all these reports are available in English for an international audience. It has reference installations at Nordic hospitals, and perhaps most important of all, suppliers that are ready to deliver these solutions. So this is then a way of making knowledge more accessible. And with the pandemic, we had a lot of time to think of how we can do things differently. So we wanted to come up with a way of making solutions even more easily accessible. And what better way to do that than to put them online? Which of course brings us back to our location and digital hospital, Grönköping. So ready to operate in 2025, the university hospital will contain about 100 of the greenest solutions available for healthcare. And as I mentioned in the beginning of my presentation, it's easy to think of this as a form of utopia or an ideal that's far in the future. But everything needed to create this hospital is already available today. And as you will hear about later, it's even available in this room. Because it is all about accessibility. The partnerships and collaborations formed in Grönköping allow for new innovations and investments that will then snowball into a further transition of sustainability in the healthcare field. In the hospital, the one looking for green technologies for the healthcare field can find both the supplier of the solution and references to its installation sites. So on the platform, we gather and describe the solutions that are ready to be used and already on the market today. So it's the opposite of trying to reinvent the wheel over and over again. Because as we are becoming more and more aware of, we are slowly running out of time to keep doing that. Because it's actually as easy as just peeking through the door of the digital hospital to find these products and services. So on the platform, there will be 11 different categories, ranging from energy solutions to pharma and chemicals, to an international arena, where we will have solutions that are not yet installed at a Nordic hospital, but that we find too good not to include in this kind of setting. So the one visiting Grönköping will be able to find in these categories 10 solutions in each, and you will find the sustainability impact, the installation sites, supplier contact information, and much more. And as I hinted to earlier as well, later this afternoon you will actually hear about some of the solutions currently on the platform. We will hear from Avidicare, Medcare, Green Furniture Concept, Paxo. And in this room today, Health Textiles is also present. So on this particular day, these green products and services are perhaps even more accessible than ever before. Okay, so now after our visit to the digital hospital, that is Grönköping, we will briefly leave it for now and come back to this room. Because as we have heard this morning, NCSH has found the right partner in Italy to kind of further boost this sustainable transition of healthcare, and that is Beside You Group. Because Beside You Group will act as a bridge between the Nordic countries and Italy in order to share best practices, expert know-how, and green solutions. So we are very excited today to be able to announce the birth of a twin platform to Grönköping. And the name of that one is Virdea, and it will be the Mediterranean's greenest hospital. And Laura Gambarale will tell you all about the launch of this new groundbreaking hospital in just a couple minutes. So just to sum up, do check out what is, in short, the world's greenest hospital. You can access the platform at worldsgreenesthospital.org and read more on NCSH's website. And of course, give me a call or send me an email if you want to learn more. And I thank you so much for listening, and I will be available here if there are any questions later this afternoon. Thank you so much.
Thank you very much. Thank you. Laura, please. You join me to complete the presentation. Thank you.
Good afternoon. I am Laura Gamberale from Beside You Group, and thank you for the introduction from Felicia and Dr. Ruben Sacerdoti. So what can I say about the Virdea Greenest Hospital? This is the starting point of our project Virdea Mediterranean Greenest Hospital, that is a natural consequence of the Swedish-Italian partnership with the Nordic Center. But let's take a step back. So one day we decided to activate a strategic unit on sustainability in Italy. As you know, we are an international advisory group that is active in many fields, and we help private and public companies and organizations in many, let's say, critical issues and needs. And so we decided to activate this new strategic area on the sustainability in Italy. So we decided to find a Nordic partner. And as we already were present in the Scandinavian market with our company in Norway, in Oslo, and so we were very keen on the Nordic mentality and Nordic point of views and mindset. And so we asked the Consul Gianni Baravelli, the Consul of Sweden, of course, Gianni Baravelli, to help us to find a partner from Sweden for this project. And this is why we met Daniel Eriksson, the Nordic Center and TEM Foundation, and we were very lucky. In 1 year time after our decision, we formed a strategic partnership at an international level. And so now we are very active in engaging projects for sustainability in Italy. For example, we are part of the Federated Innovation at Mind, which is the Milano Innovation District, and we are working on innovation projects on circularity and for hospital, for healthcare. We are working on green transition and internationalization as an Italian reference partner of the Nordic Center for Sustainable Healthcare and the TEM Foundation, and this is, of course, in Italy and in the Mediterranean market. We are also now working with an education hub. We founded a new education hub for sustainability, on sustainability topics, especially aimed to the management of life science companies, and not only, and for managers of hospitals. And this education hub has been founded together with an important partner, which is Fondazione Triulza, which is the social heart of Mind, which is the Milano Innovation District. So we built our strategic unit, and we have 4 main objectives. One is to foster innovation and investments in sustainable health in Italy and in the Mediterranean, facilitating green procurement for hospital, accelerate the development and internationalization of innovative solutions, and increase sustainable culture and know-how in the healthcare. So one good day, Daniel Eriksson presented us Gropinski, and it's very hard for me to pronounce, and that is the world's greenest hospital. And they were just starting with this new project, and he proposed us to develop this project in the Mediterranean. And this, of course, for the Mediterranean countries. And this was really exciting for us, and we found this project really fascinating. But we started to understand. We wanted to find out what interest there could be in Italy about this project. So we talked to many stakeholders. And so we met companies, institutions, hospitals, clusters, universities. And we found that there is a huge interest. So we discovered that in Italy, we are ready for the green transition. We have many projects that are ongoing and are excellent projects. But we still need more culture on sustainability, know-how, and we need also tools to stimulate investments from the side of the companies, of the industry, and investments from the side of the public sector, so hospitals. And so we realized that the platform is the perfect tool to help in this process. So this is how Virdea project started. And the Mediterranean Greenest Hospital will be built in the city of Virdea. This is why we decided to give the name of this platform, Virdea, and this will be running by 2025 and will be the greenest and most sustainable hospital in the Mediterranean region. So the platform is similar to the Gropinski and will be distinguished by the area it is addressed and will act as a place of contamination, of internationalization for green solutions. The platform is a catalyst for the greenest solutions and technologies developed in Italy and international companies in the Mediterranean, and which will be, of course, validated to be present on the platform. And the platform will also will be a container of knowledge and also information, deep diving on specific topics, sustainability and circularity topics. And this will be, of course, available for the industry, but also for hospitals and institutions. So welcome to the digital city of Virdea. Virdea is a twin platform of the world's greenest hospital. And I wanted to explain you why we choose this name. The name is a tribute to the ancient civilizations that developed on the Mediterranean. The very place where civilizations of ancient Rome and ancient Greece originated. And rich in philosophy, art, and literature, culture, and that laid the foundation of Mediterranean and European culture. So the name Virdea, in fact, originates from the fusion of two words that we took from those two ancient languages. One is viridis, and so it is the contraction of the word vir, idis, that is from the ancient Latin that means green, and idea, which is a ancient Greek word that means idea, which is a vision, a mental representation, and an intuition of discovery and innovation. So this is why we thought this was a perfect word because we want to mean green innovation. Virdea is a platform for accelerating green transition and internationalization. So it showcases selected and validated green solutions, as my colleague Felicia explained, and products and services that improve hospital sustainability performance. And so efficient management for impact problems and reduction of costs, of course, of the hospital, and innovation and of activities and processes. So Virdea Green Solution will select the solutions mainly from the Nordic country, of course, the same as the Nordic Center, and which is a master, as we could learn. We already knew, of course, but today we had confirmation on their ability on sustainability and reduction of, so mainly from the Nordic Center, which are master of sustainability and environmental impact, and from excellent Italian companies and Mediterranean countries, where technology meets creativity and innovation. So Virdea will involve hospitals in this journey and institutions in this journey, clusters, universities, creating a place where we can find green solutions, but also information, insights about sustainability. Okay, so now we have a short video. I hope that it will go. No? Maybe I need some help from the regia. May I have some assistance? Posso avere un po' di assistenza per mandare il video? Grazie. Okay, we made it. Okay, so which are our next steps for this project? First of all, we think that Virdea is a tool, as I told before, for many functions. It is not only a showcase because Virdea is a facilitator for hospitals where to find a sustainable and circular supply chain, green supply chain. Virdea is an accelerator for the green transition, stimulating the entire healthcare ecosystem. Virdea brings healthcare closer to green businesses and gives visibility to the companies that are investing and already invested in green solutions. And of course, also facilitates a collaboration among international worlds. As we can see today, we have an example. So we would like that Virdea will be the #1 supply chain platform for the Mediterranean. And how do we think to do this? Through the following actions. First of all, events and collaborations and projects, the same as the one that we started today, with institutions such as, for example, the wonderful collaboration with the Emilia-Romagna region. And we decided to start to present the project in this region because, as we heard many times today, Emilia-Romagna region is the best region, the more advanced region on sustainable topics and sustainable projects. And so we think that this is the very best start from this platform. And we see the development of collaboration in a medium-long-term basis, and we already are talking with the region to develop projects, and that will be, we already have an appointment in Ecomondo that will be held in Rimini in November, which is the biggest fair on sustainable and green topics and solutions. And we will have some results of this collaboration that we will keep on during these months together. And the Nordic know-how conferences that we are going to organize, because today is starting, it's let's say the first event of a cycle of Italian-Swedish events that will be held also in other regions, and I hope in Emilia-Romagna again, maybe next year. And Green Experience Camp, it is a 2 days camp that will be held in October, and there will be a group of Swedish speakers and companies present for talking about their experiences and solutions. Then we also will work on campaigns because we believe in this project, and I think that the campaigns are a very important thing to spread and let the platform know from the hospital sides and the industry side. Because we, of course, need to let this platform grow. And so as much collaboration and engagement we are able to generate, as much as we can have an impact to help in the green transition. It is also one very important thing, the education, because it is needed. Culture needs to be developed on the sustainability and circularity, because we all are here and we know very well about these topics, but we know that outside there is a very big part of managers and people that needs to understand better and to be engaged on these topics. So, thank you. Join the Mediterranean Greenest Hospital.
So thank you very much. We as a regional government will promote the initiative, and at the end of the meeting we will discuss how to proceed in this sense. So thank you very much for the offer, and we are ready to accept it, just to define better the way we will act upon this. Now we are entering the very concrete phase where we are going to present companies that participate to the effort of introducing sustainability in the healthcare sector. So we start from the Sweden companies that are here. So I give you the floor. Please come and present them, please.
Thank you very much. Thank you, Laura, for a very nice introduction to Viridea, and we're looking forward to following the development together with Grönköpinki, which is even hard for a Nordic citizen. So my name is Johannes Brundin, and I'm a co-founder to Nordic Center for Sustainable Healthcare, working together with Daniel and Felicia, who you heard before, and I will be a moderator for this section. So this, as we heard, will be more concrete during the day. We had heard about how to work with sustainable healthcare and how the hospitals work with sustainable healthcare, platforms for sharing knowledge. And now we will get down to the technologies that can enable this transition that we are talking about. So to do this, to my help, I have 8 companies here today, Swedish companies that will give you short presentations. This will be ideas. It's like a Swedish smorgasbord where you have all these dishes, or Italian where you have all the meats and cheeses, and you can choose and test a little bit of everything. So I would like to, this will be short presentation, so I will not take up much more time. We will have the first speaker. It is Making Healthcare Spaces Matter. It's Bruna Donini. She's a country manager, Italy, for Green Furniture Concept. Welcome.
Buongiorno a tutti, sono Bruna Donini. Come ringrazio per questa opportunità di essere qui, è un onore, è un privilegio rappresentare un'azienda svedese in Italia. Quindi tutti vi aspettavate probabilmente che parlassi in inglese, invece parlo in italiano. Green Furniture Concept è un'azienda svedese che crea interni per spazi pubblici, e nel particolare caso degli spazi per medico-sanitari, l'idea è di portare la natura all'interno, di ripensare l'esperienza degli spazi di accoglienza nelle strutture medico-sanitarie. È importante il benessere delle persone che visitano, che sono negli ospedali, delle persone che lavorano negli ospedali, avere una sensazione di benessere, e questo ce lo può dare la natura, E noi cerchiamo proprio di ispirarci alla natura per progettare spazi modulari, flessibili, che siano disegnati proprio per il benessere, il cosiddetto design biofilico, modulare, che tiene conto di ergonomia, di comfort e può guidare naturalmente in modo intuitivo i flussi di persone, in modo che queste possano muoversi in un ambiente che normalmente è freddo, è distaccato e alle volte è anche, diciamo, trasmette anche la sofferenza delle persone che lo visitano, cambiare completamente questo aspetto, farli sentire a proprio agio, come si sentirebbero a proprio agio in un parco. In un parco troviamo le panchine e qui noi facciamo delle panche modulari che hanno però la risposta a tutti i requisiti del settore medico-sanitario, che siano facili da pulire, da mantenere, che abbiano una buona visibilità dalla reception e verso la reception, perché le persone non si sentono perse in un ambiente grande come un ospedale, una clinica, una casa di riposo. Abbiamo adesso anche la disponibilità di... Ok, no problem. Ok, I'm continuing in English, so sorry. I'll go back. So the design for well-being, I start here because otherwise I'll take too much time for my colleagues that have to make the next presentation. So the design for well-being is biophilic design, modular design, ergonomics and comfort. As you can see, the slides are talking much better than what I can say, because visually it's important, but also the material is important. Natural material that are like wood, that are treated exclusively with hard wax and not chemicals. And this is also something that allows easy cleaning and maintenance, good visibility. And we have with this solution Ascent, this area, also the availability of upholstered cushions. The wood, of course, somebody asked, fire resistant? Yes, they are also fire resistant. They have been tested. It's a material that is not allergenic. And there are the so-called soft needs in the healthcare environments. It's that we need clear information, good hygiene, a pleasant waiting time, and comfortable seating, a room for privacy, and also storage and work space. Because these modular solution, the modules, you can stack one on another, so are very easy also to store. The Ascent Healthcare Solution has just won the award, in the Healthcare Award, the last 15th of June. And, well, this is one European healthcare design. We've been awarded by the Royal College of Physicians in London just a few days ago. And, but we are more proud for what we made for humans, for human-centric sitting. And also, newly developed accessibility units for people with reduced mobility or with problems in mobility. And we have also short modules that fit spaces. Basically, we can really have much more places in the same space because we go around a column, for example. We can respect the structure of the hospital. So you don't have to make architectural changes because we can fit all spaces. And also we have the visibility and the wayfinding is we take into account the light reflective values that are more and more considered. This is an example of accessibility units that, sorry, I'm just gonna check the time because I don't want to go too far. So there are elements that can be added, changed, like the seat elevation, the accessibility armrests, the elevated table, the signage, the charger, because they're also important. You have to be in a space where you can charge your device. And also the requirements, sustainability, of course. We are here for that. So we want to change the way we think to a building. We want to change that in a way. We are climate positive, you know, and this is very exciting. It means that we are doing more for the planet by producing our sitting. And this is amazing because we are also, apart the fact of having products that are easy to maintain and so on, and giving 15 years warranty, all the wood parts are finished. We also offer circular services, and I want to point out that because it's not so common, buyback and sitting as a service, but we do that. And I really hope that we could see also in Italy this model of circular economy real, in real, not just in words. So for every module sold, we plant a new tree, but this is something that many companies do. We have really reforestation plants in Colombia since years. So, the fact of offering circular services is an added value to improve the circular economy. Sorry for my...
1 minute.
Yeah, 1 more minute. Do you have any questions? I would be happy to answer if you have any questions.
You're welcome to ask any questions after each
Sorry,
presentation.
I've mixed a little bit because I started in Italian, then I went on in English. So
it was
sorry.
very interesting. Thank you very much. Do you have any questions? Because I find it very interesting.
Maybe about, I'll make a question and an answer about the upholster, because it's strange. You say a bench is in wood. So how do you meet these two things, upholster with wood? We use upholster cushions that are padded with cocoa fibers. So this is also sustainable. We really care. So yes, we care. Thank you.
Thank you so much, Bruno. Yeah, perfect. Okay. Yeah, so to the next speaker, a unique system for ultra-clean air in medical facilities. Peter Höjerback, CEO of Avidicare. Please take the stage. Oh, you can take it.
Buongiorno a tutti. Purtroppo parlo solo un poco italiano, so I better continue in English instead. Sorry for that, but let's see now if we have any... Yeah, here we go. We have something really difficult to face. It's a problem we have faced a lot during the last few years. It's not a new problem, but healthcare-associated infections is a terrible thing. Nobody should go to a hospital and come back worse than they were when they came in. This is something that is a huge killer and something that has affected so many of us. And that is something that is really, really fundamentally not sustainable, because all the treatment of these infections and all those additional surgeries you need to make that you could have avoided, we believe that at least half of these are avoidable. The most deadly and most costly of all these infections are the surgical site infections. Those are the infections you get when you are operated on, when your protective layer, your skin that protects you from all infections, is open wide, and bacteria can enter your body, either directly via the air or maybe indirectly via bacteria landing on instruments and implants, then being put into the body. The cost is enormous, and the suffering and the deaths are enormous, and we can do something about it. Unfortunately, the last few years have also taught us that some infections are airborne. These things happen also in healthcare, and we know that both Italy and the whole world suffered a lot because our hospitals were not resilient enough. We couldn't protect our own staff properly, nor could we protect patients fully from these kind of infections. This is one of the major learnings from the pandemic, that we need to upgrade our hospital infrastructure to make them more resilient so they can work still, even under these kind of very, very difficult situations. So what can we do about it? Well, kind of obvious thing, if you have less bacteria in the air, you get less infections. If you have less viruses in the air, you get less infections. So how do you get rid of bacteria out of the air, especially inside operating rooms? Well, let's have a very clever ventilation system that really is proven to reduce the number of bacteria in the air. Because you may not know that, but where do those bacteria that cause surgical site infection come from? They come from the skin of the staff. So you have these sources, huge sources that are just spreading bacteria-carrying particles, about 1,000 bacteria each minute. And you have them immediately by the wound, where you have all those previously sterile instruments, previously sterile implants, and now you have them just next to bacteria generators. I mean, that's insane. But if you have a properly working ventilation system, you can flush these bacteria really down to the floor and out of the room where they do no harm. And what we can do with our ventilation system called Opragon is to make sure you have this happening in the whole room, not only in the middle of the room. We have measured during thousands of surgeries how much bacteria are there in the air, and the threshold you need to be below is called 10 colony-forming units per cubic meter of air. That's the golden standard, because if you're in that area, you get way less infections than you otherwise do. And as you can see from the slide, it's super clean in the wound area in the middle. Somewhat further out from the center of the room, it's still below 2 colony-forming units per cubic meter of air. And also in the periphery, where we have put those implants and instruments, it's still ultra clean. Now, this is something you can claim, but what about, it's not just me talking here. We have had universities for a number of years now studying this independently and making publications in like the Journal of Hospital Infections and many, many more magazines saying, yes, this is actually true. We've been working with KTH, the Royal Institute of Technology, do lots of simulations, which is something I know you're working a lot of here also in Emilia-Romagna region, to do the simulations to see how it really is working. Because you can't see bacteria, you can't see viruses, but if you can visualize how they're moving, then you can do proper solutions that work. Just by an example, I can show you that we are able to move a hospital, I would say an Italian hospital in general, would probably have about 50 CFUs per cubic meter of air. So that would be the red line, and you would maybe get 2% of surgeries you have infections. But if you were to install an Opragon, you can cut down that number of bacteria in the air by a factor of 10, 1 order of magnitude cleaner. So you would cut down the number of infections to half. And that is really sustainable, because all that work and all the energy wasted to cure the infection, I mean, that's a lot of energy savings just there. But not only that, compared to other traditional technologies, our technology is 30% more energy efficient than the standard laminar airflow ceilings. And that's just because we are using a force of nature. The air we are releasing into the room is about a degree colder than room temperature. And as you all know, cold air is heavier. So our air falls down. Actually, it falls faster and faster and faster down. So it sweeps things more and more, rather than being released with high speed and then going slower and slower and slower. So this saves a lot of energy for our hospitals. There are details, but in one comparison with the standard room, that's the small white square. If you're using like 14,000 cubic meters of air an hour, you get about 10% of the room clean. With ours, you're using 7,000 cubic meters of air, and you get more or less the whole room ultra clean. It's super comfortable. You can use any temperature in the room you want. You can have it really cold, really warm. It doesn't matter. We have right now 300 installations. And if you want to visit one, there is one Italian-speaking customer very close to you. It's in Lugano. So we can organize trips to you and with your hospitals and make sure you can go up there. You can feel it, listen to it, experience it for yourself. So it's all around in the hospital system. We're also doing some isolation rooms right now, looking in some waiting rooms. And we have a partner called MLS in Italy. And my colleague, Marco, please stand up, is fully Italian speaking. Thank you very much.
Thank you very much, Peter. Do you have any questions? I can ask you, how much energy have you saved for your customers?
We're actually on our website, we're publishing an energy counter, so everybody can track how much energy we'll be saving. And right now it's about 16 million kilowatt hours, and that's a lot of energy. So it's a huge carbon dioxide positive impact as well, along with that, of course.
Okay, thank you very much, Peter.
Thank you.
So to the next speaker, safe and sustainable nitrous oxide usage. Jonas Lund, CEO of Medclare. Welcome.
Thank you. Good day to everybody. Unfortunately, my Italian is absolutely no shape to be spoken here, so I will save you the embarrassment. I represent a company from Sweden called Medclare, and we work with nitrous oxide. And maybe the first question then is, why should we bother about nitrous oxide? Well, nitrous oxide is a very potent greenhouse gas, and we need to take care of it. It's also something that you basically critically need in hospitals due to the fact that without nitrous oxide, the costs will increase tremendously with other methods of anesthesia. We work with measurement, collection, and destruction. All of this with the goal of ensuring sustainable nitrous oxide. As I mentioned, nitrous oxide is a greenhouse gas. 1 kilogram of nitrous oxide equals 298 kilograms of CO2. Looking at the smallest installation we could have, we would offset in a very small clinic, perhaps serving 3 mothers birthing per day with nitrous oxide. Taking care of your nitrous would equal planting roughly 3,000 trees. So as you can imagine, you can really make a difference. And I'm proud to say that this is a technology that we can deliver basically tomorrow to any hospital here in the region who wants to drastically cut down the CO2 emissions. We offer cutting-edge technology. Our products are energy efficient. That's a must if you want to work on sustainability. Another huge benefit is that we provide a safe work environment. Long-term exposure to nitrous oxide is dangerous to healthcare staff. And this is also in many countries a hindrance to start working with nitrous oxide. If you are in a system where nitrous is not very popular, it's typically due to work safety issues. We can offer a solution to that, and you can introduce more nitrous oxide. And of course, this becomes a cost saver. A typical solution would be that you install a mobile destructor to get started, let the staff notice that the technology is non-intrusive, it's low noise emissions, it's basically doesn't change the way they work today. And once you are confident in technology, you can scale it up to centralized solutions that take care of the emissions of nitrous oxide from the entire hospital. We had the president of Region Skåne presenting earlier today. It's really nice to be in the same room as her, due to the fact that she's actually my biggest client. Well, perhaps not personally, but the region is. Region Skåne has been in the forefront since 2004, I think it is, with nitrous oxide collection and destruction. They are now looking at replacing the old destructors with new technology, since there are advancements, and has purchased several mobile units for us. And the feedback we get from the region is that each mobile destruction unit is a cost saver, due to the fact that they can treat patients who undergo painful procedures in the same room as the patient is being examined. They don't need to transport the patients in hospitals. They don't need to occupy surgery rooms, and they don't need surgical doctors for procedures that can be done with sedation from nitrous oxide. So In essence, we offer CO2 reduction, but we also offer a potential cost saver for hospital systems. I think that's something that is growing in importance as the population gets older. The pressure on the hospital systems will be higher, and we can certainly offer a really comprehensive business case looking at both CO2 and cost. This is not a local Swedish company that only been selling to Sweden, although that's our primary market. Since 2 years back, we are trying to internationalize the company, and we have gained a very large interest in the UK and in the Netherlands. They're driven by totally different user needs. In the Netherlands, it's based on work safety. There is actually a very low debate on CO2 emissions in the Netherlands, unfortunately. But we have sold to over 20 hospitals simply to offer work safety solutions. In the UK, it's the opposite. Everybody is focused on CO2 emissions. The NHS, the National Healthcare System in the UK, has decided to cut their emissions of CO2 by 55% by 2030 and be net neutral 2050. Of course, they need to focus on the big emitters, such as nitrous oxide. And the final question I would like to ask myself then is, why not remove nitrous oxide? Well, you can't, because it's too expensive to replace it with other medicines or other painkillers. Thank you. How's that for timekeeping?
Yeah, that was quick. Do we have any questions? Can you explain a little bit more what is driving the... I know that there has been a lot of interest from UK. Yeah. Can you explain a little bit more about what is driving their interest?
UK is very interesting because at first there was a very strong opinion being led by young doctors in the UK and young pharmacists, realizing that the healthcare system is actually one of the nation's largest emitter of greenhouse gases. And they saw a very clear connection of greenhouse gases and increased cost for the medical system, because let's face it, people are dying from increasing temperatures, not at least in Italy. And this is costly, both for the medical system and for the country. The first suggestion then, of course, is let's get rid of all nitrous oxide. But once you sit down and you start to analyze, you realize that you can't. If you would, for instance, go with epidural for all birthing mother, the cost is immensely higher, not to mention the patient risk. So it's basically it's down to crass economics.
Okay, thank you. Do we have any questions? Okay, thank you, Jonas. Yeah, now to the next speaker, Endless Clever, Maurizio Sorone.
Correctly.
Very Italian.
It's very Italian, really.
Yeah. From Paxo.
From Paxo in Sweden.
And the title is, you need to give us some more clues on what it is.
I will. First of all, I would like to thank you all for inviting me. It's really thrilling out of many reasons. I started in Paxo for about 10, 11 years ago, and the reason was obviously to be able to pay the rent, but at the same time I wanted to work with something that I really, burned for. And all us in this room right now, I can feel and sense that we all urge for the sustainability. So I think you understand the parallel. But moreover, I think also the collaboration between two countries, and specifically Sweden and Italy, is really intriguing as well. I actually was, just a small note before I start really, I was made in Italy and born in Sweden. My mother came to Malmo, which is this Napoli of Sweden, and she gave birth in Sweden. And she is actually from the region close to Reggio Emilia, which is Castellarano, Sassuolo, and Maranello. So I'm actually a local native as well. So, okay, back and forth. Next. So, yeah, I wanted to talk about the awareness. Not really. Everybody are aware. What we at Paxo want to draw the attention is to the unawareness, because in many cases when we also talk about, for example, I just heard about the procurement systems, the platform that you use, etc., we always talk about the money and trying to decrease the expenses, etc. Well, that is of course a side effect of the procurement. But the main thing should be, what result does our product give? What is the result? I mean, we just heard recently the 1 kilo of nitrous oxide turned into 300 kilos, and then you have this machine dividing it, etc. That's really good, you know. And I imagine it's not a cheap model. It's quite expensive. So what do you invest in, and what do you get from the investment? This is the important thing, I think. And we all live on the same planet, so I mean, you know, it's not a Swedish thing or an Italian thing or a French thing. It's a global thing. So we have the global environmental challenges, as you know, no doubt about it. CO2 emission, air pollution, oceanic pollution, deforestation, species extinction, and in general you have the soil degradation automatically, and also the waste. So, and this is what we are aware of, but we are unaware of how we should cope with the problem. But we're on a good way, on a good path. Bear in mind that Paxo started 40 years ago. So for 40 years ago, we started this journey. And in many cases, it feels like, wait a minute, are we too old for this? Is the world awakening right now? No, it hasn't. I mean, NCA's Nordic Center has been working for over 20 years, is it? Was it, more or less? And it's incredible to listen to the stories that, you know, constantly trying to... So, where can we use it, who can use it, and when can we use it? Well, the answer is very simple. I think you all know. Everywhere, everybody, always. It's a very simple system. It's very, very simple. It's invented by Paxo, so it means that we are constantly innovating the product, and we are constantly trying to find new ways of making it more sustainable than it already is. Here are some pictures that I would like, because pictures says a little bit more. I actually included Riga as well, not being, you know, trying to just go for the Nordic countries. We are situated in many countries, but this is the Lund University Hospital, Riga. You have the Finnish new hospital in Sairaala, Nova. As you can see, there's a lot of stands. They invested in all these stands, which is on the left side from you. One stand with the lid and the pedal, which was a requirement. We have walls solution. We have different solutions depending on the nature of the need. University in Aarhus, which is in Denmark. As you can see, there are different solutions for different areas because waste is everywhere, right? Apart from the healthcare, Paxo resides in Horeca, you know, hotel, restaurant and catering, food industry, retail, professional cleaning. So we work with a lot of different segments because waste is everywhere. And in many cases, my first question to the probable investor is, I mean, if you go to a hospital, the equipment is quite expensive. And in many cases, or in food industry for that matter, and in many cases, it's really astonishing to see that the waste bins are like, you know, bought from IKEA. And I'm really puzzled by it because the machinery costs millions and millions of Swedish kroners or, you know, hundreds of thousands of euros. And they don't they don't invest in the waste handling system, which I think is really crazy. Anyway, what factors are important in comparison between traditional waste bags and longo pack? That is a question that we often get. I mean, are we even comparable? In a way, we are, you know, but it's a very unique system, and it's Swedish. Coming back to the inventions coming from the Nordic countries, there were 5 factors, I believe, that somebody raised, you know, thinking about why do we develop things. I have a 6th one, actually. The country is very small. There's a lot of forest and a lot of lakes. You go out and fish, and there's nothing to do, and then you come up with an idea. That's why the Nordic countries have a lot of inventions. It's a joke, anyway. So we look at the quantitative and the qualitative aspects of it, because in some cases the qualitative could be monetary if you go in the long run. It's an efficient system. There's always a new bag in place. I can just I'll quickly demonstrate. This is a bag of 60 meters in a stand, and I can just change it whenever I want. I just do like this, pull the cable tie, and change and cut it. It's very hygienic. I never touch it, the waste, so there are no hidden costs. There's always 100% filling degree. Obviously, if you change in an operational room, you would change every bag and throw away a lot of plastic unnecessarily. We developed the material to become 50% recycled, the last 5 years actually. And this is a schedule just to quickly show you. I don't know if you see the 5 red dots. That's the longer pack system, the bags that we actually deliver. The schedule is made by TEM. It includes raw material, recycled raw material, transport, production, incineration, and this is the impact by 1,000 kilos of waste. So even in the middle where you have the waste bag, which is completely recycled, you see that the CO2 emission is higher than longer pack. Challenges, I'll just go through them. As you heard, the procurement system, you guys go old-fashioned. We are never invited, we are innovative. How do we describe this system? How can we be a part? I think that they should allow innovative products in the future. And to ask you the last question, is the world flat or round? Well, there's a lot of people who live in the round. I like to live in the flat or the other way around. Anyway, grazie.
Thank you. Since I have kids, I'm going to the primary care units every now and then, and every time you run into one of your products, so they are everywhere in Sweden.
I get a lot of SMS and pictures and stuff, people that visit veterinaries or hospitals. Hey, look what I found. I know.
A quick question. Who is the decision maker when you approach a hospital? Is it the people who are working with the waste, or is it
that's a good question, because you see there is a bag on top of a furniture, you might say. So the problem in procurement is that furniture makes a tender, and then you have the plastic or the consumables. And we try to tell them that this is a closed system. It's not about whether you want to put it as a consumable or not. So that's the problem. But normally we have hybrid rooms in Sweden, which I don't know if you have that in Italy. So they can test the products, months ahead before they announce the actual tender, which we think is nice, because then they really see the difference of what they do. And then maybe, or not maybe, in many cases, they will actually add it on. We reside in basically all hospitals in Sweden, as you understand. So Region Skåne is also our biggest customer.
Thank you very much, Maurizio.
Thank you.
And now the next speaker, Let's Build Sustainable Hospitals Together by Tarkett, a leader in sustainable flooring. Marcelo Martins Meira, from Tarkett. Welcome.
So good afternoon, everyone. And thank you for having me here to bring the sustainability message from Tarkett. As mentioned earlier, Tarkett is one of the European leaders in flooring surfaces, floor finishes. My name is Marcelo. I'm the sustainability manager for Tarkett for Europe. And today, I was given 8 to 9 minutes to tell our story, to present some of our products and bring a concrete case. And this is how we decided to structure the presentation. But we'll start with a concrete case, an example of a hospital that is running for years and years now with our products. And then from this hospital, I'll go to Tarkett's view on circular economy. And then I'll bring you one example of a concrete product that you can find in the market. And this is how I would intend to close the presentation. So to get started, I bring the Karlskrona Hospital. It is a hospital in Sweden. And we have one of our products installed in this hospital for more than 30 years now. Here, the name of this product is what we call our IQ ranges or IQ collections. In this case, it's the IQ Optima. It's a PVC flooring, as you see in the picture. Some parts of this flooring, they have been installed there in the 90s, but some areas, they date back from 1971. So it means that for us, sustainability is something that is part of Tarkett's DNA for a while now. And sustainability, from our perspective, it is also directly connected to long-lasting products. And why am I saying this? And then I shift to the second part of the presentation. Okay, so I'm talking about long-lasting products, and I invite you to take a step back and one step forward for us to have an overview of the whole life cycle. So taking a step back, this use stage, we have the raw materials that compose our products, right? So here at Tarkett, we're going to see more in details how we do this, but it's something that is pretty crucial for us when it comes to circularity. So what are the components of our floorings? Are these components, will we be able to use these components 30, 40 years from now if we are to recycle them? And then taking a step forward from the use stage, the long-term performance, to the end-of-life stage, as I mentioned, what will we do with this flooring once we remove it? So are we able to recycle flooring back into flooring? And this is how I will lead this presentation for us to really close the loop, tackling the challenges in different life cycle stages of the product. So one concrete example that I wanted to bring today as a product is what I mentioned before, our IQ products. We call it a smart choice for a sustainable hospital. And I wanted to start bringing figures. So if I asked you, okay, we installed, for example, for a given hospital, 20,000 square meters of our IQ solution, okay? If we were to compare this product to a regular vinyl flooring, and we could run a life cycle assessment for us to evaluate the carbon footprint of these two products, our products would get savings close to 300 tons of CO2. And why? Because I'm going to explain how we do this in details, but one of the reasons is that our floorings, they are recyclable at their end-of-life stage, which is not the case for every PVC flooring you have in the market. And then I'm going to tell you how you do it step by step. So remember the 3 steps: the raw material, use stage, end of life. So I'll start with the first step, the raw materials we choose. And as I said, it is crucial for us to be transparent on the raw materials we put in our products. We're really proud to say that, I don't know if you have already heard of phthalates, but basically there is a lot of debate around the phthalates. These are chemicals that are not currently banned in Europe, but Tarkett, we were really pioneers in many years ago, and we decided to go phthalate-free for our European floorings for a couple of years now. So this is one example for us to make sure that the chemicals that are part of our products, they're able to be recycled once they reach their end-of-life stage. I listed some other things that we take into account, because health and well-being is something that is crucial. So when choosing the components of our products, we need to make sure that once the product is installed, it doesn't release what we call VOCs, or volatile organic compounds. You've probably heard about this. These are pollutants that are released by construction products in general, not only flooring. And we make sure that we respect the most restrictive standards in Europe. Then regarding the recycled content of our products, for our IQ products, the recycled content we're around 25%, and we want to keep increasing this recycled content more and more from flooring that we get to collect at their end-of-life stage. And to customers that are possibly interested, we have the possibility to offer this alternative of PVC that is not fossil-based. The use stage, this is something that I mentioned earlier. We make sure that our products, they are installed to last long, they are easily cleaned, and we get to easily repair them. And the end-of-life stage, as I said earlier, we are able to recycle our flooring at their end-of-life stage. And we have gains from the fact that we don't incinerate and from the fact that we replace virgin raw materials. So this is the end of the presentation. It was really fast. I had a couple of seconds left. We have a carbon calculator for us to see the carbon gains from our different products. Do not hesitate to see us after this presentation. We can run calculations live, and it's available on our website too. So thank you.
Thank you. Thank you very much. Do you have any questions? Then I have a question. The material that you're recycling, is it only parquet floors or is it like all kinds of floors?
It depends. We have a program, the program that is called a Restart program, this program that allows us to collect flooring. We are able to collect flooring from ourselves, obviously, and from competition, there is an analysis to be done regarding the components of the competition. As I said, the phthalates topic is a huge topic because we cannot put in our factories products that have phthalates, for example. So yeah, we can, but an analysis has to be performed in advance.
Okay. Any more questions? In that case, Marcelo, thank you very much.
So thank you very much, everyone.
And now to the next speaker, maximum energy savings with fulfilling economic requirements. Per-Erik Nilsson, CEO at Chalmers Industriteknik and project owner of Beloc, or executor of Beloc, maybe.
Yeah. Almost right. I am, in fact, the CEO of a company that is called, that is named CIT Energy Management. It's a consultant company closely related to the university, Chalmers University of Technology in Gothenburg, where I'm also an associate professor. But today I'm here to tell you a little bit about an assignment I have as the coordinator of a national network in Sweden, a network including 28 of the larger non-real estate owners in Sweden, and approximately 30% of the floor area, non-residential floor area. So every meeting we have representatives for 30% of the total floor area, non-residential in Sweden. And of them, there are a lot of regions with hospitals and healthcare buildings, but we have other groups as the offices, schools, and these three are the largest groups of non-residential buildings in Sweden. So, one of the projects we have developed within this group, and this is the group of building owners that have developed this method, is basically coming from a question they have: how far is it possible to make the buildings energy efficient? Now we're talking about existing buildings. How far is it possible to come, and how should we do it? We know that, at least in Sweden, the new buildings are somewhere around 1 to 2% of the total building area if you compare to the existing building area. And if we are aiming at reducing the use of energy, which goes in hand with the sustainability, we have to look carefully into the existing building stock. So, how far is it possible to go, and how should it be done? There is a really, really short answer to that. And this is the essence of the total concept method, as we call this method. Short answer: identify and carry out the package of measures which fulfills the building owner's demands of profitability. If you go into an existing buildings, you start talking about making energy efficiency measures, you will always end up discussing with someone that take the financial decision. And then you should have the tool to have this discussion and provide the input data the decision-making needs. So the key words: package of measures and profitability. Profitability is up to each and every building owner to set their profitability demands. But package of measures, that is something that is really interesting. This method consists of 3 steps, and we heard a little bit about it before lunch today. We have first step, analysis and identification of package. This is the most difficult step, and when you look into a package, then you have to be very skilled as a consultant. We are today educating consultants in Sweden, and they have the possibility to be certified total consultants. And some of the members of this network, they are requiring from consultants that they can provide what we call certified total consultants. So they have to know about this method and how to carry it out. After this package is identified, it will provide the building owner with a basis for a decision on how to go further. And that is to carry out measures, and after they are carried out, they have to be followed up. The follow-up phase is very typically forgotten. But if you take a little bit closer look at the first step, and this is just a flash. Sorry. This is just a short flash into the resulting diagram. And as you can see, we talk about energy. There is nothing about energy in the resulting diagram. On the y-axis, we have reduced annual costs. On the x-axis, we have the investment. And then we have a lot of lines. And the lines, they represent the return on the investment. So the further up you end, I will put in some lines here. The further up you end, the more profitable will the investment be. And if we look at the package carried out for the building, 6 different measures, how will it look? The method always requires take the first, the most profitable measure first, then take the second most, the third most, and so on. So we have a first measure, M1, the second one, and the further the angle points upwards, the more profitable the investment. So the first one is more profitable than the second one, and so on, third, fourth, fifth, sixth. So we have 6 measures in a package, and we can see that the entire package ends up at return on the investment on 7%. That's a really good return on the investment. This particular building owner had a requirement on 5%. That was their profitability demand. So now they can easily take the decision to carry out the entire package. And you can see that the measures that are less profitable at the end are not profitable by themselves. But if you use this as a package, then they will actually be really profitable, the package. If you end up with the say 3 or 4 first measures, then you will never carry out the measure number 5 and measure number 6, because when you look at them as single measures, they will be really, really unprofitable. So, package profitability. This one you saw earlier today. If you would like to read a little bit more about this, take a look into the total concept method. You find it on the homepage totalconcept.se. You have it in a number of languages, unfortunately not Italian, but you have it in Estonian and Finnish and exotic languages. So, thank you.
So this is maybe the Belloc method, maybe a collaboration topic in the future.
I think it would be a great possibility, because the one that has been very much involved in this is the Swedish Energy Agency.
And a quick question. How would this kind of process look like if someone is interested? What's the first step, and what can they expect?
Well, there are a lot of possible ways, but if we would I would like to see if it's interesting for our Italian friends to have 1 or 2 demonstration projects, just to get the knowledge and see, is this something that is possible for Italy? I think we will try to talk a little bit about this during dinner tonight.
Okay, thank you, Per-Erik.
Yeah, thank you.
And to the next speaker, it's one software to monitor EHS legal compliance all around the world. Måns Fonander, head of Notisum, please.
Thank you. So, good afternoon, everyone, and thank you for having me here today. And thank you for all previous speakers throughout the day. Now it's getting late in the afternoon, and I can see more and more tired people here. So I think I will waste 20 seconds of my valuable time today. So if everyone just stands up, stretch a little bit, and put away phones and computers for a short while. And then we can sit down again, and hopefully we can keep focus for another 5 minutes. I will keep it short for you. So put away phones and computers, hopefully. Well, I got 1 extra minute. Great. So we had a lot of products today, and now we're going a little bit more technical. So this will be a legal platform. And I will go through a little bit about the company that we work for, why a product like ours is necessary, and how we do it to help our customers. Here we go. So Notisum, that is the company name in Sweden. Globally, the product name is Checkup, Safety, Health, Environment and Quality. We've been around in the market for the last 25 years. And today we support roughly 1,800 companies in the Nordic countries. And by that, we are the market leader in the Nordics. The last 2-3 years, we have been focusing on a global expansion. And today, with Checkup, we cover roughly 100 countries globally, and Italy is, of course, one of them. We belong to a larger group on the stock exchange market in Sweden called Karno Group. And as I mentioned, apart from the other companies being here today, we have a platform. So it's a software as a service. It's a legal platform, a tool where you can monitor legal changes, and it's based on the ISO suite of management. So you have ISO 45001, 50001, and 14001, all with the same requirements when it comes to legal monitoring and compliance. So why do you need a software like ours? Well, if you're an ISO certified company, Doesn't matter if it's within energy, environment, occupational health and safety. You have a clause in the ISO certificate that says that you have to determine legal requirements and other requirements. And you need to have access to all the legal requirements that is applicable to your business. So what are the organization's legal and other requirements, and how are they determined, accessed, and kept up to date? And this part of up to date is usually the hardest part to continuously keep updated. Another section of the ISO certifications are the monitoring part. Oh, no, hang on. Let's go forward again. So monitoring. Well, now you have identified the laws and regulations that you need to follow because you are a company. Then you need to monitor them, you need to measure them, analyze, and making evaluations. So if you have a legal register, you have to identify all the laws and regulations that is applicable to your business, then you regularly need to evaluate them as well, doing your compliance check. Not only have them in a document, you actually need to see that you are following the laws in the region that you are having your business. And this is a picture that we don't use that often in Sweden anymore, because this is not the case in Sweden. Legal monitoring systems have been on the market in Sweden for the last 25 years. Today we are maybe 15 different companies doing roughly the same thing in Sweden, even more if you look in the Nordic countries. But when we go outside of the Nordic countries, we had a subsidiary in China for a couple of years. We were the first company with a service like this in 2011 on the market. And when we look outside of the Nordics, it's pretty much the same. So when we speak with companies the first time, they usually have an Excel list or maybe a Word document. And there you have all those laws and regulations that is applicable to your business. And then you assign someone to keep it updated. You need to go to the government pages, the local authorities. You maybe have some kind of newsletters, external consultant searching the web. And of course, it's not updated regularly. You can miss important changes and, of course, miss changes as well, since you don't have any single source to find everything. So what we and other companies doing instead is to collect everything. So we have a big database with roughly 1 million legal documents, and then we keep them updated. So we monitor these pages. Every night we scrape the pages, try to find are there any changes, and if there is, we read them through, comment them in a way so everyone can understand it, because this is usually people working with environment, health and safety. They are not the lawyer of the company. So you need to understand what is the most important part of this change. And in the same way, we summarize everything from the beginning. So in a short summary, we describe what is the takeaway from these legal documents, and what do you need to think about? What is the key requirements? And if you then do the applicability test in a system, you will get help to identify maybe 100 laws and regulations that's applicable to your business. And whenever there is a change, well, instead of you or someone in the company going online and try to find it and so on, we will notify you, of course. We're sending out an email, and when you log into the system, there will be a push notification telling you about the latest change, what you need to think about, and then you can acknowledge. And when you acknowledge the change, you tell the system I have read and understood it. And then it comes to the analysis and the compliance check. And this can be done throughout the company. It could be done by the manager, but we have many companies sending out to hundreds of managers on different levels in the company. So everyone will get only the legal documents and applicable parts that is for their area. So it could be different sites, different departments. Everyone will just get enough to secure their compliance. And today, there's roughly 1,000 changes every month in the system, and this is then sent out to all companies that has this specific law or regulation in their legal register. And usually I show this on the screen, but since it's a bit hard to have everything, I just made a few print screens. And if someone is interested in it, just go to checkup.com and sign up for a free trial, and you can try it out by yourself. But this is the first page, and you have your to-do list. That is all the changes that have been sent out. Now this is my trial count, so I think I have 280 tasks to do in the right corner. But hopefully it won't be that many for you. So this is what you need to do, all legal changes that you need to acknowledge. You will get an overview of your compliance, how many documents have been included in a compliance check last year, and what is the results. You can then find applicable legislation for your company by looking under topic focus, subcategories to find all applicable laws and regulations, and doing compliance checks where you can fill in how compliant you are with each law. And I'm in goal. Yeah.
Do we have any questions? Yeah, so my question here is, what is the first experience from your customers, like before and after? What are they finding out, and what kind of first benefits do they see?
The first benefits is usually that I find out that when going outside Sweden, at least, when going globally, that there is functions and services like this. We're not the only one. There are many products on the market, but usually when I find a system like this from the beginning, it's by Googling it, and they have an Excel list, and I find out that, okay, we can just import an Excel list to system, and it will keep it updated, and we will save both time and money in the end. So that's usually.
Okay, thank you very much.
Thank you.
So now it's the last but not least, manage your energy. Nordic Energy Audit with Thomas Kindstedt.
That's right.
CEO. Welcome.
Thank you. Manage your energy. How hard can it be? We are a company within the startup world, just becoming in a scale-up situation, and the energy is all around us. We have a starting point with energy audits. That's why we have this name. But we have taken this a little bit further because the audits are kind of tricky. So nowadays we focus on what's going to happen when you've done the audits, and can we make it automated? So what we are doing is that we bring this to a digital platform which we provide to you as a software as a service, a cloud platform, mixing that with best practice and a lot of know-how. We have a strong connection to universities and the research institute as well. So we package the cutting-edge know-how about energy management. To give you an understanding for the possibilities that we have put together in this software as a service, we're looking at different sectors. These figures are a couple of years old, since it changes over time. But it shows you all the Swedish sectors divided on NACE codes. And the blue staples shows the amount of energy used, and the green dots are showing the potential energy saving for that sector. This gives us a quite a good understanding for where are the potentials, and we can drill down to these and see each and every business actually. And I have put some red circles around two of them which could be of interest for this audience. The one rightmost is for human health activities, and you have real estate as well. And you see that they have, both of them, quite a good possibility for savings, 25–30% I would say, at this snapshot. This is an example of what we can do. Energy, you are forced to act on some mandatories. Sustainability we have heard a lot of. You need to report that somehow. You have some national environment codes also to comply with, as well as energy auditing. And these three are the main ones for us to help the companies about how to maneuver about. Push harder. I was saying energy management, how hard can it be? We try to tie together all the disciplines we have identified for being successful in managing the energy. And to the leftmost, you see the strategy and planning. That's typically what the management sets as a target for a business, or could say a country as well. And then technology and implementation, that's typically the equipment we are buying to achieve what we think we are targeting. New fans, and new this and that. Then you have controlling. All around us we see a lot of real-time measurements and so forth. We have seen lots of industries being confused about all these gauges showing how much energy they do consume and so forth. But they have a hard time to connect it to their goals, what actions they need to do. Then you have organization, that's the people. How shall they act upon what? And last but not least, the corporate culture. This is the whole package we're talking about to get energy management working. And that's the foundation, as I will show you later on here. It could be a bit complicated, actually. So we have made a picture to illustrate a typical case, to bring some business value to an organization about energy management, and take it in some steps, work in a structured way, having some digital tools, of course, but also addressing processes and way of working, and set some foundations along the way, and you will be good to go, so to say. And this could take some time. I mentioned that we have a tool. We call it NEED. We like to play with words as well. We think we need to manage the energy. It's a digital tool, cloud-based. We are measuring, of course, what's going on in the business. But the aim is to take control of the use, to make it scalable. If you have one hospital, for instance, that's really nice. But let's say that you have hundreds of them. Then you need to be very cautious about who is progressing, who is not. And we can benchmark between each other as well. And that's when the magic starts to happen, when you start benchmarking against others, and as well learning from each other. That's also one of the key elements in this, to connect all together and sharing information, both between each others and also between European databases, which we are connected to. Well, of course, the target is to lower the energy costs, of course. And what we have seen, that happens when you start doing this kind of work. A kind of result of this picture shall illustrate how to proactive work with energy usage. As you set the targets, work with them, use the tool, use the know-how, etc. And over time, you will get reductions. And a reference. We tried this tool last year, actually, around the Baltic Sea. So we tested it in 5 countries: Sweden, Estonia, Lithuania, Poland, and the last country, which nobody wants to work with anyway nowadays, Russia. So I excluded that one. But for illustration, we tested this way of working, the best practices, and the tool set in 5 countries simultaneously. And we achieved some things, as you see, and we're kind of proud of that. So we'd like to test this a little bit further. I think I'm ready now.
Thank you very much. Yeah, maybe as a question, I could ask like a little bit more where you ended. How is the customer experience this? I think you maybe wanted to round up with that.
Customer experience?
Yeah.
Well, it depends on who is the customer, but since we're working with quite a broad but the industries really likes this because we tie together how they shall communicate and work with their goals. Let's say that the industry had a goal of saving 5% per year. That's easy for the management to say, but how to bring that to all the layers between or down, so to say, that's really the key point. And by measuring, you can also fulfill the sustainment, global sustainment goals by being data-driven, so to say.
So you can also connect the management with the people working.
That's the whole point.
Yeah,
exactly.
Okay.
So this far, positive results and reactions.
Yeah. Okay. Thank you very much.
Thank you.
So this was the last presentation from. And I hope this has given you some new ideas of technologies to use, look into more how it can be working in the Italian context. Also the system and solution providers that can help get started with this work. And yeah, all the companies that has been doing the presentations here today are either members of the Nordic Center for Sustainable Healthcare or are engaged in the energy agencies projects in some way. There are also some of them on Grönköpinki, the world's greenest hospital. So you can either visit our webpage or worldsgreenesthospital.org for more information. Thank you very much. And please, next.
Hi, thank you. Thank you to the Swedish companies. I'm Sauro Vicini. I'm the cluster manager of the Health Cluster organization here in Emilia-Romagna. I would like to introduce the company that are part of our cluster, but also part of two more clusters because we are, let's say, a network of clusters. So we involved also the cluster on green technologies and the cluster on building and construction. So those three companies that I will introduce you will come from those three associations that groups together the companies and the research organization of the Emilia-Romagna in their respective sector. I will start with Neuster system. So I will call Benedetta Copertaro that will speak about their waste management system. Thank you.
So good afternoon to everybody. It's a pleasure for me to be here today. So I am Benedetta and I am a research and development scientist at Neuster. And today I would like to introduce to all of you Neuster, which is a company who provides solutions, sustainable solutions for the treatment of medical waste. We can consider ourselves as pioneers in ecological waste management solutions. Our history begins in 1996, so well before the Stockholm Convention, which basically invited governments to reduce or eliminate persistent organic pollutants into the atmosphere. And we are now able to offer integrated solutions for the disposal of different types of infectious waste. Our mission is, our mission is to turn every healthcare facilities into a model of sustainable waste management. And for this purpose, we can provide the best technological and ecological solutions to ensure that the healthcare is managed in a total safety in every country around the world. We have over than 600 installations worldwide, and we also provide specialized assistance for the registration and the accreditation of nuclear technologies in all the countries where these technologies will be distributed and installed. So this is how we imagine our ecological hospital. So we are able to develop technological solutions for the treatment of potentially infectious medical waste coming from different medical worlds. We also develop technological solution for the treatment of wastewater coming from infectious diseases and autopsy rooms. And we also provide a solution for the treatment of the liquid waste coming from biomedical laboratories. And from the last year, we also develop a new machine for the treatment, for the sanitization of the indoor air inside the hospitals. All of these technologies can be monitored thanks to our web app. It's like a software that allows, it's a cloud-based software that allows a remote control of our technologies. We also promote a new healthcare culture. We can provide an e-learning platform for the remote training of all the staff which is involved in the use of the equipment and maintenance programs. And for our dealers, official dealers, we developed this reserved area where we can upload and where they can download all the documents who are classified based by sector and technology. So, but now let's talk about our sterilizer. So the working cycle of our sterilizer is quite simple because it's based on a mechanical breakdown like impact and friction of the waste inside a closed vessel in a slightly negative pressure, and the waste is heated up to 150 Celsius degree to achieve a microbial inactivation of 6-log reduction of Geobacillus stereothermophilus spore. Now let's see how the machine works. So basically you have a rotor which is fitted with special blades regulated by an inverter who operates at a high speed inside the vessel. And during the cycle, the constant impact and friction of the waste against the rotating blades determines the release of the heat, and consequently, you have an increase of the temperature up to 150 Celsius degree. So before the evaporation phase, there is the maceration phase, where the waste is shredded and reduced to a small flock with a reduction of volume of about 75 and 80%. And when the temperature reaches 100 Celsius degree, so the evaporation phase can start, and the initial weight is reduced by about 15 and 20%. So when the liquid has completely evaporated, the sterilization phase can start, so the temperature rapidly increases up to 150, and this temperature is kept for at least 30 seconds to guarantee a correct homogenization of the temperature inside the flock. Then you achieve the sterilization, and then you have the cooling phase. So the residue is cooled down to 95 Celsius degree, and it is automatically discharged. So the treated residue is dry, unrecognizable. It's uniformly sterilized. It is odorless, and it is reduced both in weight and volume. Now, ozotherapy is our technology for the treatment of the liquid waste coming from biomedical laboratories. It is a containerized solution. So this is the process of fluid neutralization, which is based on 3 different steps. So basically, during the first step, you have the fluid waste collection coming from different automated analyzers. After the collection, you have a pre-treatment with the ozone for the removal of for the reduction, of the biological hazard. And after this, you have an advanced oxidation process thanks to the ozone with the hydrogen peroxide, where you have a complete oxidation of the fluid waste. After that, there is the treatment with granulated activated carbon for the final filtration. And at the end of the process, you have a system, a pH redox system, who can check if the liquid can be discharged directly into the sewage system, or if the liquid should start a new treatment cycle. This technology has been sent to Karachi Hospital in Pakistan together with another biological treatment machine, so with our partner. And the water recovered will be used to irrigate a nearby polo ground field. Now let's talk about the environmental sustainability of the on-site treatment of medical waste. So last year, we developed together with the Polytechnic University of Marche region a life cycle assessment analysis. So we wanted to verify if our solution is environmentally more sustainable than the current practice. What we found is that thanks to the on-site sterilization, you can achieve a 70% reduction of the environmental impact compared to waste-to-energy plant with disposable plastic containers, and you can obtain a 50% reduction of the environmental impact compared to waste-to-energy plant with disposable paper boxes containers. The same study has been developed for our machine for the treatment of laboratory liquid waste, and also in this case we wanted to verify if this solution is more sustainable, environmentally more sustainable than the current practice. And also in this case we found that the possibility of using the on-site treatment of laboratory liquid waste can allow a reduction of the environmental impact of more than 80% compared to waste-to-energy plant with disposable plastic containers. And the environmental strengths of of our scenario can be explained by different aspects. Regarding the potential infectious solid waste, you have the decrease of the incineration load on the whole impact, because you are going to incinerate something, a residue which has been reduced by about 70% of its volume and 20% of its weight. And obviously, with the on-site treatment, you have the decrease of the transportation load on the whole impact, because you need to have a daily transportation from the hospital to the incinerator for special waste, and also you avoid the impact deriving from single-use containers boxes production. So these are a few Swedish memories that I had during my stay in Sweden. I worked as a postdoctoral researcher at Dalarna University. I work in the field of energy technology, so just a few memories. So and so tack så mycket.
Thank you very much. Thank you, Benedetta. There's some question for her? Yeah, please. Yeah, just a second for the mic.
going back to your explanation about the residue in flak, did you ever think, seeing that also you're working with university and research, did you ever think about recycling completely this flak?
So yes, it's a good question. So this residue, first of all, has a very high calorific value because it is mostly plastic, like 90% plastic and 10% or 20% paper. But together with the Australian National University, we performed two different end-of-waste studies. During the first study, we performed a LCA analysis. So this residue was used as sound insulation for the sound reduction, but it was like a residue coming from diapers, treated diapers for elderly. And during the second study, we evaluated the possibility to use this type of waste as an aggregate for cement or concrete. And in this case, the treated residue was coming from hemodialysis products. So you mostly have plastic, hard plastic like PVC. And so, yes, we are now trying to find a solution for the treated residue.
That's very encouraging. Thank you so much.
Thank you so much.
Thank you, Benedetta. Next company from the Italian side is GVS. GVS is a big company focused on filtering solution. I know they are collaborating with Politecnico di Torino, which is a partner of Nordic Center. So I will call Enrico Callegati from GVS to speak about their solutions.
Thanks to Sauro and the cluster for having invited us. Well, I will start with a few words about GVS. We are a company headquartered in Bologna, Italy, with roughly 3,500 employees, 17 production facilities, and these figures are not updated because a few weeks ago we concluded the acquisition of an Italian company called Emotronics, which increased our total turnover and head count by roughly 50 million euros and I think like 100 employees. We are specialized not only in healthcare devices, but all the technologies and solutions related to filtration. Which of course means a lot of healthcare filtration. It accounts for roughly, I think, 50% of our turnover. And the rest is also personal safety, so personal protection equipment. Actually, the business of personal safety started from the acquisition of a Swedish company many years ago. It was called Segre. I don't know if any of you knows it, but we don't have operations in Sweden since several years. But also air safety, and we have also a division on energy and mobility, which is not relevant for this, but just to let you know that we are somehow a multi-sector business. Our customer, we started and we still mostly are subcontractors of large producers of medical equipment, such as, I don't know, Baxter or Sartorius, for which we produce specific filtration units that normally are integrated into their devices, which might be, I don't know, drug inoculation or drug inoculation devices or things like that. So we started as a main focus as process experts. So the process of producing medical devices, basically injection molding and also membrane functionalization and membrane modification. What I would like to do now is to focus on a specific project. I apologize in advance because I actually, probably it was my fault. I thought I was supposed to present the strategy of DVS related to sustainability, but we realized that it was more important to focus on a specific solution. So we just want to present this for you, and yeah, the one device that we produce is what we call HMEF filters, which means heat, moisture, and I don't remember, and filtration. So it's basically, it's a device that is used in mechanical ventilation. You know, mechanical ventilation is when you need to artificially breathe, but what happens is that we have a very high level of mortality due to the exposure of infection. Our colleague from, I don't remember, explain how many infections you can take in a hospital, and especially when you are subjected to mechanical ventilation. This is something that happens very quickly, very often, unfortunately. Because the inhaled air is different from what our lungs need. It's cold and dry, and this leads to excessive drying of the respiratory act. And excessively dry, the mucous membranes are highly vulnerable to microbial agents. So, what we produce normally is this device that you find under the red arrow, the HME filter. Heat and moisture exchange. We know now what was the E, is exchange filter. That are known as artificial nose because heat and humidify the inspired technical gas. Unfortunately, and here maybe I speak common sense, but every time we try to mimic the human organism, we realize how wonderfully complex it is. And it's not enough to make a little plastic ring with some polyurethane inside to replicate its functions. So, for instance, what happens with the normal, well, first of all, what happens with the normal products, the standard products made of synthetic originated materials, they are suboptimal in some functions. There is also another issue, which is that, of course, and since we are producers of medical disposables, this issue has been raised a few times during the day. I realized that the numbers of consumed devices are huge, and let's say the end of life recovery and the strategies for these devices are still at a very low point. I happily met the colleagues from Neuster System, which were presenting before, whom I already know, and I know that they are addressing this issue from another point of view, and I think that sooner or later we will have to do something together in this regard, because the problem is always that what happens to our medical devices when they are in the hospital. Of course, we are focused on producing them, but it's another story. So, what's the limitations that are currently on the market right now? They have an inadequate antimicrobial efficacy, low durability, and they are not biodegradable. What did we develop? And by we, I mean we are working here in close collaboration with the National Research Council of Italy, the Institute on ISTEC, on ceramic material, which It's not ceramic here, but they have also a specialization in this field. So they have, based, let's say, on a product that we normally sell, it's a product that we do on the market, completely synthetic product, so originated from synthetic chemistry, which is an HME filter. They developed a new concept of this filter, which is totally coming from low-cost material derived from waste recycling of food industries. So, and by this, they inspired from the human body, because you know that what we have in our nose that helps our respiration is the mucus, which traps allergens and moisturizes and warms the inhaled air. And the chemistry of mucus is based on glycoproteins. Now, where are also glycoproteins contained? In two byproducts of agro-food industries, which is the chitosan and the gelatin. The chitosan is contained on the shells of crustacea, seafood, but it's not seafood, it's I don't know, okay. Crabs or lobsters and things like this. And the gelatin, it comes from the, especially from pork meat, is a byproduct of pork meat processing. Their chemistry, and unfortunately I'm not a chemist, so we should have the people from CNRs here, but the chemistry of these two substances can be used to produce aerogels with glycoprotein-like composition that basically works as a heat and moisture exchange filters, let's say, with a more, probably with a higher level of efficiency compared to what is on the market right now. The end product of this research project is a new material to be used as a mimetic of mucosa functioning as HME filters, which has a high filtration efficiency, low per source drop, fast moisture exchange, antimicrobial properties, and ensures a high degree of comfort and protection to the patient, and it's fully biodegradable. So theoretically, it can be a huge leap forward in the sustainability of the life cycle management of medical devices. Consider that what we as GVS produce right now is a filter, which is, okay, so this is the same. Okay, unfortunately, how do you see the picture here? What this? Non si può usare il puntatore, vero? No. Like this, we produce a filter very similar to the final prototype, which is this yellow and black device here, but we produce it not using chitosan, but using polyurethane. So it can be a breakthrough. Why it's not yet on the market? Because the initial projection on the production costs of this material are really unsustainable. Because normally the devices are sold for a price which is in the range of a few cents of euro for each, let's say, ring, and let's say for the industrial facilities that are available in the moment, this is not yet something that is economically sustainable. Also considering that the process that is used to produce this aerogel is called freeze drying, so means to lyophilize the project and is highly energy intensive. But we think that this collaboration with the Italian National Research Center, with the view to, let's say, identify possible avenues for bringing to the market this product and start replacing the materials that we use, consider that GVS produces a few billion of medical disposables per year in all its production facilities, because we produce, as you saw, several different kind of products related to medical filtration, to healthcare filtration. I'm going backwards. For instance, flow regulators, blood filters, insufflation filters. These are products that are produced in total in very high numbers. We think that start to study how to bring to the market eco-sustainable solution is a starting point. Maybe we will come up with a sort of demonstrative prototype which is not yet sellable in large numbers, but it shows the commitment of the company to contribute to the sustainability of the healthcare systems, and also will create some knowledge that maybe in the future with higher, with more energy efficient processes can lead to a drastic improvement in the sustainability of filters. So I think I'm done. Thank you. Unfortunately, I have to leave immediately after this call, but our environmental and social sustainability manager, Roberta Frulla, which was sitting beside me, is here. And if you want to exchange contacts, she will be more than happy to speak to you. So thank you very much.
Thank you, Enrico. Question for him? Okay, so you are free to go. Thank you again. So the third company from Emilia-Romagna is Politecnica, so I would like to call Carmen Romero and Enea Sermasi from Politecnica. Thank you.
Hello everyone. Last but not least, I represent the company Politecnica, which sounds like a university, but it's not. We are a consulting company made of architects, engineers, and we design hospital and healthcare facilities, from planning to feasibility studies and detailed design and any technical assistance. We are established in the city of Modena here in Emilia-Romagna, and we work in Europe. And the pinpoint that you see above, very close to Skåne region, is actually on the other side of the Öresund Bridge, which is Copenhagen. We are working on a project hospital in Kö. And in Emilia-Romagna, we have worked in many cities for many hospital projects. And I'd like to introduce some of our sustainability principles before leaving the floor to Claudia, who is our hospital architect, because we would like to just give you our approach in terms of sustainability principle, and the first one is actually not a technical one. We call it cultural intelligence, which is, in simple term, would be putting ourselves in someone else's shoes. And then Dutch professor Hofstede came in and studied the components of the relationships in the business and the human relationship, and create a matrix, gave it a nice name, which is cultural intelligence. And now we have research, a scientific method to do what we usually do with common sense. The ultimate goal of this first of our principle is just to study the mindsets of the different cultures when we operate in Italy with international companies or when we go abroad, in order to transform the differences into opportunities. I had just one example from this morning presentation. I think the colleague from the Nordic Center for Healthcare Sustainability presented us slides about culture and politics in Sweden, and there was a sentence who said, "We follow old rules." So I, in my case, as an Italian engineer, I would say we try to follow all the rules desperately sometimes, because it's not only the goodwill that makes the difference. But the serious point behind this joke is that in Italy, in our construction sectors for hospital, we have so many rules, so many regulations. We are overwhelmed by specification in all phases of procurement, design, that it's really a hard exercise to cope with when it comes to designing hospitals. But if we see that issue from another perspective, and that is our cultural dimension, a cultural intelligence approach, we can say that we are now capable to move into this high-density regulatory context, and we can provide our international partner with an added value when they want to come into the Italian market to try to bring some innovative products. So we can be of help in that case. So this is just one of the examples. If you surf or you Google Hofstede dimension, you can just check if your mindset related to whatever country you want, you can make a compared analysis, selecting any country you wish. I will not go deep into this because I now want to pass the floor to my colleague Claudia Romero, who will briefly tell you our experience both in Emilia-Romagna region and also in Scandinavia. Thank you, Claudia. The floor is yours.
Hello. Good afternoon. It's a pleasure to be here. Thanks for the invitation. And it has been really exciting to see so many different topics about sustainability. So we will tell you our experience. That is a comparison between what we do here in Italy, especially in Emilia-Romagna region, and what has been our experience in Denmark that maybe is nearest to you. Okay, we have been working in Emilia-Romagna region from several years. We have done some mental disease building. Also, after COVID or during COVID, we have done some modules, prefab modules for intensive care beds into hospitals. Also, we have been working in a really important building for municipality and headquarters office, where there are included labs for environment control. Actually, we are working in the most important hospital of the province of Ravenna, about 550 beds. As you can see in this slide, we have been working straight with Emilia-Romagna region, especially during COVID. We have been analyzing and supporting them to make decisions about the placement of new intensive care beds, where to put in, how to aggregate, and how to distribute in different provinces in the region. After 220, and actually, if you can see in the right, actually we are working in 8 different hospitals in the Emilia-Romagna region for about 13, 14 inside refurbishment and implementation of new areas of the hospital. Also, we are working in where we have our office headquarters that are in Lombardy and Tuscany. How we were, I was telling to you before, one of the most important project was to donor the design and all the work site and supervision of 2 modules, one of 30 beds for intensive care units beside Policlinic of Modena, and the other one about 18 beds besides always another important hospital that is Baggio Vara. Here we have increased our technology design with prefab systems and also about biocontamination modules. Actually, we are working in the, Ravenna Hospital, and in this case, we are doing we are going in deep in the emergency line flow of the process of emergency line. In this case, the important thing is the separation, the division of COVID flows from standard patient flows. Of course, we hope that in the future we don't have any more this, infectious disease problems, but it's an opportunity of this territory because it's is a place near the sea where we have a lot of tourist people coming, so this becomes another type of problems, another type of emergency. So the vision is general. It's not only the epidemic and the pandemic problem that we have today. In this case, BIM, of course, has been necessary to verify all the interference that we have with MAP and some other services. And as you can see, we have dedicated a line for infectious disease. Of course, Emilia-Romagna is a virtuous region, as everyone has told you this morning and during the day. In this case, it's important they have been using also maybe before it became a rule, the minimal criteria for environmental use of materials. And another important thing, actually, Emilia-Romagna hospitals have been awarded by the Institute of Hospital Engineering as they have won a prize for environment containment and sustainability about light using. Okay, and this is a focus as how we know this territory and how we can, we have seen how even if we are working in different provinces, the protocols of managing health is always unique, is always universal, and I think this is a good thing for to have a good result of process. In this case, now we wanted to talk to you about our experience working in Denmark. We are actually working in region Zealand at Co region, and this is a hospital. Is 800 beds hospitals. We have about 20 operating theaters, 25 diagnostic, about 100 treatment rooms. So it's and it's a university hospital. And I say this because here we needed to do comparisons. The big difference is that instead of us that we have a lot of rules, in Denmark, we didn't find any accreditation best practice rules. The only rule was that all the bed words needed to be simple words. And this, for us, was really, we wanted to start doing check, 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 we have this, and we didn't find anything. So this was the biggest difference. About organization, of course, we have organization for homogeneous areas. We have proposed some modifications. We follow a lot the lean thinking design, the lean management of hospitals. So we found ourselves with a similar mindset. In this case, we have 4 towers of 8 levels. We have logistic in the basement, outpatients in the ground floor, critical area in between the MAPS areas and the bed wards.
So, but now is I arrive where I think that in Italy we have still a lot of things to do. It's technology, it's automation. So, of course, we are similar in process, in flows, in health protocols, but technology, we need to work. We have space to introduce technology, automation, digitization. And in this case, of course, we have some technologies that both of us we have, but we are missing some others. We are missing, for example, automatic bed washing. And this, actually, Politecnica is working with university to check the control of infection disease in hospitals. But what we found is that the type of bed that in Italy we buy is not, cannot be used in the bed washing tunnels because the technology is with steam, and our beds cannot be introduced in a tunnel with steam. So we are working with these industries to verify if it can be changed to our system, because it's difficult that we change our beds. So as you can see, it's really interesting to understand, to know what's happening in another places. Another technology is pattern nozzle lift. Of course, you know that what we are talking in Italy is really difficult because it's really, really expensive. But it's important to analyze the costs and the benefits. And this is also sustainability. As it was said this morning, it's not to reduce cost, is to use this cost to apply in new technologies where we can trace the movement of all the trolleys and beds that we move daily in a hospital. I think that in this hospital we will have 2,400 movement between trolleys and beds during a day. So it's really important to have the knowledge of what's happening, how to manage this. Another technology that we don't really use still or is chute system. But we have it, but we don't have the traceability of the type of waste that we are treating. This is a focus of what's happening in Europe. This is 2017 numbers, but it's really important. This was before COVID, and the more richest nations in Europe still has problems with infectious disease. Okay, let me go on. This is chute system. Another thing is time. Time is really a synonym of sustainability. We have PTS, but this is the evolution of PTS. In some hospitals in Italy we have it, but not all of them. You can imagine what it means to reduce 20 minutes in an emergency, for an emergency patient. It can change, and it can be less stress for the people that works inside. So we have, as I was saying before, we have still space to optimize, to make evolution in the flows of logistic, and not only. Of course, well-being, this is really important. I appreciate a lot about the mindset of Danish authorities, really sober, but as you can see again, we have technology. And one important thing is the use of technology in some big hospitals can reduce the real estate value of surface, because we can reduce waiting areas, because I can guide the patients where they need to go without making multiplication of the waiting spaces. Of course, from render to mock-up, in some hospitals, actually in Italy, we are doing make-ups with some difficulty, but it's going inside the culture that we need to make training. We have verified that much training we do in a mock-up, less are the changes that we will have in the process of designing and of building. About difference, these are only some technical difference, but for example, in Denmark, we didn't find dirty corridors. In Emilia-Romagna doesn't have dirty corridors. It's the first regions that avoid the dirty corridors. But we have some other difference. For example, there are places in Denmark to make preparation and observation of the patients completely separate from the operating theater areas. And of course, here, with the management of beds, we don't need to have the patient pass box. Maybe you don't know what it is, the patient pass box, but there are some procedures that we can substitute and use another types of procedures using new technologies. For example, a big difference, we used to have operating theaters in line, and this for us is flexibility because we can do change in the future and to introduce new technology. In Denmark, we found that it was better to have a place to introduce the materials, the device, and to assure some more hygiene. So what is better, what is not? I think the important thing is to know what we are missing, what we know how to do, and what could be imported and inserted in our process. Again, mock-ups, some focus about operating theaters. In Italy, we have the culture of to have prefab operating theaters. Instead, in Denmark, it's a sober space. We have plasterboard walls, we have enabled painted surface, we don't need Korean, we don't need HPL, so why? So there is a balance. It's really important and interesting to, now we can choose and we know that it can be done in some other ways. And this is really important difference. I know that in sustainability is also the daylight is preferred in Denmark to have one corridor because the daylight is really important for the well-being, not only for patient and family and visitors, but also for the staff. But we can find that in Italy instead we use double corridor, and it really was a good choice during the COVID pandemic because we could choose the dirty area and the clean area without compromising one flow. Of course, as you can see, there is a big difference. We don't have our standards ask for only 10% of single bed rooms. Actually, it is been increasing this number. It's not rule, but most hospitals are asking for 30%. But as I said you before, in Denmark, it's a rule, it's the only rule. And it was a safety, it was really useful during the pandemic because it was easier to have a patient in a single room without with less possibilities to continue with the infection in some other places. As you can see, our standards are in surface are lower. We have, if you can see, we have 36 rooms in Denmark, 23 rooms in Italy. but we have some more beds, but we have less surface. So difference, which is better, which is worse, I think there is an equilibrium. I'm finalizing. Of course, we adapt with the geometry that we have. In Denmark, we have one air handling unit for one finger, okay, that is, it develops in 4 levels. In Italy, we have used the air handling units. In this precise moment, we are increasing the number of air handling units, but to open dirty areas in the case that we need to open them. So we have a really big flexibility. Another, this is our room in Denmark. It's more than 20 square meters. In Italy, we have the regulation that for 2 beds is only 18, so you can see that there are really big difference. Another thing, and this is the last slide, is about integration of systems in communication. I think that technology again comes to help us. In Italy, actually, for this kind of system, really useful intensive care units and operating theaters, we have the predisposition because it's still really expensive. In Denmark, we are using it, maybe not as much as it can be used, but there is a big integration and a communication system for the staff. Well-being, I think this is common in every place in the world. It's important how we work, where we work, and how we feel. Thank you very much.
Thank you. Any question for Politecnica? So in a few minutes, you will have the possibility to exchange some thoughts and some words in the coffee. But before, I will call Nicole and Laura for some logistic information for tomorrow. Thank you very much. Thank you.
Okay, so this is just for some logistic information. So you know that this evening we have the welcome dinner, and we are very happy to have you in the restaurant for a cocktail, which is starting at 7:30, and afterwards there will be a dinner, of course. It is a very nice place. It is over Bologna, and it is a panoramic restaurant in open air, so I think that will be very pleasant and informal. And so there will be a bus that will come and take you at your point in... oh, sorry, this is for tomorrow. Sorry. No, I'm sorry. Tomorrow you will have a bus coming from, and Nicole will explain you. But this evening you will reach the restaurant with the taxis, because it's the best way to arrive to the restaurant. So you are welcome. I also would like to extend the invitation to the Italian companies that today had their speeches, and so you are very welcome to the dinner if you want. And this is also an opportunity for matching with the Swedish companies and the delegation. Thank you.
So just a few quick information. If you can put the slide. Okay, thank you very much. For the day of tomorrow, we will be in Mirandola in the morning and at the Sant'Orsola Hospital in the afternoon. So for the travel to Mirandola, the pickup point for the bus is in front of your hotel, the Student Hotel in Fioravanti Street. There will be a bus stop in front of your hotel, and the bus will be there at 8 a.m. sharp. This is very important because we have 1 hour and something more to go to Mirandola, and it is very important because we have a full schedule tomorrow. And we will be in Mirandola for the morning and for the lunch, and then at 1 p.m. we will be back in Bologna, and at 2:30 we will be in the Sant'Orsola Hospital. So it is a very full day, and after the visit in Sant'Orsola Hospital, you will be free to visit Bologna or to return to your hotel or to leave if you are planning to leave tomorrow in the afternoon. So see you this evening at dinner, and thank you very much for being here.
Just to say thank you to Nicole from the cluster organization, because she managed everything from our side. I would like to say thank you to beside you, to Laura, to Fulvio Mastrangelo, who is following us on YouTube, I think. And then I will say thank you to Regione Emilia-Romagna and Arter for hosting this event, and in particular I would like to say thank you to our guest. We will see you tomorrow, but thank you to being here and visit our region and our companies, and now you can exchange some word with the companies from our region. Thank you again.